We're back with Dr. LeClaire and Alice Luer, who both work with dialysis at St. Peter's Hospital in Helena. We're discussing kidney disease. So I want to continue with you, Dr. LeClaire. Can you tell us what the contributing factors are that can cause kidney disease?
Well, the most common cause of people developing kidney failure is actually people with diabetes. Unfortunately, only a small percentage of people with diabetes develop kidney failure requiring dialysis, but about half the people who are on dialysis at any time are people with diabetes. The other causes of end-stage renal disease or kidney failure are hypertension, that's usually poorly controlled, and there's a myriad of other diseases that can cause kidney failure, including things like polycystic kidney disease, which is a genetic disorder, or various different inflammatory diseases, autoimmune diseases such as lupus can cause kidney failure as well. The goal is try to prevent the progression in any of these diseases by treatment that's tailored for those particular disease states.
Okay, so what can people do who have these various conditions to actually help protect their kidneys?
The most important thing is blood pressure control. Because the tools that we have available to help protect the kidneys are somewhat limited. Diabetes control is very, very important as well. And so those are the things that I, as a physician, focus on, particularly people with diabetes and hypertension. The other disease states, it depends on what disease state it is. And sometimes we are able to use medications which suppress the immune system and potentially keep people from developing kidney failure from these diseases. Hopefully in the near future, we will actually be able to treat people with polycystic kidney disease so that they don't progress. That is a significant subset population of people on dialysis. It would be wonderful if those people didn't progress.
Okay, awesome. Alice, from the nurse educator perspective, what tips could you give people to help them to keep their kidneys as healthy as possible?
You know, it all goes back to the basics. So healthy diet, healthy weight, and then just healthy lifestyle. If you smoke or use tobacco products, you need to stop using tobacco products. They're just, you know, they're vicious on the body. So overall general health of the body, if a person has overall general health, then usually the kidneys are a lot happier too. So other things, certainly manage your disease states like hypertension and also diabetes. And one of the big things on that is for hypertension is sodium control. You don't want to take in more than about 2,500 milligrams of sodium a day, which is not much sodium, especially if you start looking at labels. You'll see how much sodium is in our processed foods and in our canned foods. So sodium control is an important part of my training I do with somebody if they have hypertension.
So, and you said weight control. Do you have people actually needing to weigh themselves every day, or is this something that is really kind of tailored just to each individual person?
It really needs to be tailored to every individual person. Certainly a person that has end-stage renal disease and is on dialysis, we want daily weights on them because that is how we figure out what needs to happen during their dialysis treatment to get them back to a weight where they don't have fluid overload in their body.
Okay. So, and a lot of times when you're working with people, they obviously know they have kidney disease, and so you know they know what really they need to do. What do people who may not know that they have kidney disease, what would they need to know about what to look for kidney disease? So
as Dr. LeClaire mentioned, there are the 5 stages of kidney disease, and a person at stage 1 through 3 may be totally asymptomatic and not have any symptoms at all. And where their kidney disease is noticed is during an annual physical exam with a routine lab work that's done. And then it's up to that person's primary care provider as to how they want to be how they want to treat that kidney disease. They can choose either watchful waiting, where they recheck the lab within 6 months, or at the next visit. And if those levels that they look for in the blood, which is usually creatinine and BUN, stay stable, then they may choose to do nothing at that time, just watchful waiting. If a person is progressing along the way, if they get to stage 3 or 4, they may start having symptoms like loss of appetite. They may be very fatigued, but they can't sleep when they go to bed at night. And those people should be referred to a nephrologist just to watch, so that they can get on the appropriate medications to help prevent any further progression of that disease.
So by the time they get to you, it's a serious condition and something that we know we need to do something about. Is that a fair assessment, Dr. Untitled?
It's, as a nephrologist, I have a range of patients who have either relatively normal kidney function to very severe kidney function. And obviously, it's quite depressing when I see someone who has advanced kidney disease and I have to tell them that you have advanced kidney disease. It's similar to telling someone they have cancer at that point. But for the most part, most people that I see, fortunately, are in the stages of 3 to 4. And one thing that I think is really important that people realize is it's not so much for me as a nephrologist, it's not so much your kidney dysfunction when I see you. It's really, do you have a progressive disease? And that's where things like a simple test like a urinalysis, where we're just looking at your urine, can be very informative for myself and for the patient to sort of have an idea of, is this a disease that's going to get worse? Or is this a disease that just simply you have some scarred kidney? And it's just not cleaning the blood as effectively as it should. Clearly, everyone's biggest concern is that the kidney will get worse, and you'll get to the point where you need to have some type of dialysis.
Okay, great. This has really been good information, and I think we'll be back right after the break with more with what happens after you've actually been diagnosed with kidney disease. Stay tuned.